Welcome. Today I want to talk about the atlas, a very important part of our upper spinal area. This particular area is so important, probably the most important, because the bottom of the brainstem comes through that area. It actually goes down to the second vertebrae. But the atlas is the top. It's the most important. We look at the atlas, we think of strength. But this atlas, if you look at the vertebrae up top, and I'm going to show you on a smaller model, I'll show you a real two bones out of someone's body. This atlas is what allows most of our rotation to look left and to look right. This is the back of our skull back here. This is a very vital part, and quite commonly, this particular bone can subluxate, rotate, and cause many symptoms. I'm talking about headaches, to fatigueness, to tingling, to weakness in the body, as well as other organs. Because in order for the energy of the brain to get through that spine and come out these 31 pairs of spinal nerves, it has to pass through that atlas first. And if there's any rotation, any misalignment that's affecting the neurological system, it's like you stepping on a garden hose trying to water the garden. You're blocking off a degree or a percentage of water, but when this rotates, you're blocking off a percentage of life energy coming from the brain to try to communicate to the cells and organs of our body. So we look at the atlas. This is a real atlas out of someone's body, and below it, it's the axis, which is the second bone. So the atlas up here, the axis here, you have a dens here. And this dens fits right in there, and you have ligaments that obviously hold these bones together. And if you look down inside, okay, that is where the spinal cord, the bottom of the brainstem, forms into the spinal cord right below this second vertebrae. But if you look here, you can see that this is the area where the back of the skull, the back of the skull sits on. But this area is where the atlas turns like this. So when I turn my head, watch me and watch the atlas. As I turn this way, the atlas turns. And as I turn this way, the atlas turns. Now, as this particular atlas rotates or subluxates, that's when we develop many problems. There are many practitioners that only practice upper cervical adjustments, upper cervical care, because as you correct things above, everything else in your system starts to repair and heal. As we look here on the autonomic nervous system, as well as the spinal and cranial nerves, as I push up on the atlas up here, you can see that all the organs and tissues are being generated from this particular area below the brainstem. It's quite complex, but just to show you something, how different nerves as we come down affect different levels. That's why as we come down, 4, 5, and 6 can affect the shoulder, arm, and the hand, the fingers. And mid-back can affect the organs, obviously the stomach, the heart, can affect between the ribs, intercostal neuritis. Lower back, the L4, L5 affects the sciatic nerve as well as the male-female reproductive system, kidneys, urinary tract system. So it's quite complex. Very important you understand what I just reviewed, because as we do this particular technique, a very subtle technique, hopefully we can regain mobility up on the atlas. There's nothing forceful about this particular technique. This technique is a very simple, a very soft, easy, gentle technique that in many times can release that fixation, that area that potentially may be jammed in an area, that may be not moving, that once we free it up, we put movement back into there, and movement equals function. The most important thing in the joints of our body is proper mobility, proper movement, because that is biomechanics, the movement, the bio-movement that happens within the joints. What I want you to do first, I want you to come right below with your thumbs, and I want you to feel what we call the mastoid process. If you look at the mastoid process here, you can see exactly where it's located, but I'm going to come close to the camera. Right below the ears, you'll feel a bone here. It comes down, it's like a nice thick bone on the side of the skull. And you have one on the other side right here. Take your fingers and touch that. So I want you to take your thumbs from the mastoid process and move it downwards a little bit, just a little bit right below it. You'll feel those two little bones stick out. That is called your lateral mass, the lateral mass of the atlas. As you can see, this is the right lateral mass, the left lateral mass, and these little lateral masses right here is what you're going to feel. So you're going to feel two little bones stick out, and some of you may say, well, I feel this one a little further back or forward than the other one. That's because this atlas can rotate like this. In other words, as it rotates to the right lateral mass is going to be behind, and the left lateral mass is going to be in front, as you can see right here. So, as you come down on the lateral mass, I want you to come behind it. Now, what I want you to do is your thumbs are behind it. Okay, you'll feel that bone on both sides in front of your thumbs. And just turn to the right and turn to the left. And you'll feel the bone move right underneath your thumb area on both sides. So remember, if you turn your head to the left, the right lateral mass is supposed to go forward, the left lateral mass is supposed to go backwards. If you go and turn your head to the right, the left lateral mass goes forward, the right lateral mass goes backwards. Now what I'm going to have you do is keep your fingers there, and I just want you to turn to the right and hold that right side. Go back to the right and do that just about 5 times. Good. Keep that pressure in there. Good. Okay. Good. Now go back to the left. Hold that pressure. Okay. And one side may feel a little more restricted. 3, 4, 5. Good. That's it. What we're doing is we're applying firm pressure behind the lateral mass. And as we turn to that side, that lateral mass, if it is jamming, many times it can release just from that pressure. You can do this technique, particularly if you're having symptoms of headaches, neck problems, or any symptom throughout your body. You can do this technique, a couple times a day. It's not going to hurt you. Basically, we're just contacting the area. We're just turning left, okay, turning right. Turning right again and turning left. And turning left. We're just turning the head as we're applying pressure, but as we turn, that pressure sometimes will just gently allow the body to release on its own, and hopefully you can experience miracles. I really hope that this technique helps you. Remember, it's subtle, it's very simple. It's just something that we're working biomechanics within the joints, that if something's not moving, just the mobility can free it up by putting a little pressure in there. And I would love to hear your positive comments below if you have any. I ask you to share this video with others and subscribe if you haven't, so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.